I first became involved with the American Heart Association many years ago. Think back to 1970. I'm a college freshman and I have nothing to do over the summer. But fortunately, I was able to get a grant from the American Heart Association to work with a cardiac surgeon at the University of Kansas in Kansas City. I worked on a project with him, and interestingly enough, 15 years later, after I'd done all my training, my medical degrees, and my fellowships in cardiology, I came back to Kansas City working with the same surgeon. I became involved with the local chapter of the American Heart Association about 3.5 years ago when I first moved to Minnesota. I thought it was really important. I mean, the American Heart Association does so many things for so many people. It supports research, it supports scientific meetings, and most importantly, it supports public education. My experience with a local affiliate has been just fantastic. They've done a great job of informing the public. They've worked on many important issues. I think back to about 5 or 6 years ago when we did a survey when I was in Kansas City about women and heart disease. We found out that most women think they're going to have trouble with breast cancer, much more so than heart disease. Yet a woman's chance of dying from breast cancer is only 4%. Her chance of dying with a form of heart disease is 50%. Women didn't know that. But with the American Heart Association's Go Red for Women project, which has been going on now for a number of years, that perception is dramatically changing. And people are learning that not only is heart disease an important problem for them, but it's largely preventable. The local organization has been fantastic. The local organization has been involved with many public relations campaigns to inform people about what's going on. They've been involved with the legislature to try to get some rules changed about school physical education. They've been very, very active.